vaping, and I use it sparingly. 1 month supply might last me several months, in fact. But that's because I'm a mature user, I'm used to it, and I know exactly what I need.
Do you build up a tolerance to it?
No.
So if you stay at the same level, you're okay. You
That's
don't
an
have
excellent
to go
question,
a higher
because
dose.
most others, it's called a tachyphylaxis, which means that, you take one opiate pill,
Right.
then no, there's no tachyphylaxis. I'm using the same amount that I did in the beginning. Sometimes, if the pain is really, really bad, I might take an extra puff. But no, there's zero tachyphylaxis to it.
You said an extra puff.
Because the vapor, right?
The vapor is,
Vapor.
and I'll go into the vapor in a minute.
I was told from a dispensary that with the vapor, because I've never smoked and I didn't want the vapor, that your pain level comes down right away. But with the oil, it goes up and then it kind of stays more.
Well, that's exactly right. And now that I've discussed the thing about it, that's how we bring it into our body. The two primary ways are through our lungs or through our mouth and intestine. There are patches, slow release, that people could use, just like nicotine patches. And for those of us who can't eat, they're a transrectal, so a suppository, or you can rub creams on an area. The advantages of vaping, and it's really nothing like smoking, because it's a clear solution just containing the chemicals in it. It's really an inhaler, you see an inhaler sometimes, but marijuana doesn't get activated until it reaches a certain temperature. So you push a button and it heats it up, and then you take just a little sip. If you inhale like a cigarette, you'll cough a lung up and waste a lot of the material. So a little sip into your mouth, you let it cool off for a second or two, and you breathe it into your lungs. It doesn't smell. I don't feel any tastes or anything like that. And then 2 minutes later, you know where you are. If that's enough, then you stop. If you need a little bit more, then take some more.
What is it the fact that it's instantaneous, just like you putting the pill under your tongue if you have a heart
The
attack?
pill under your tongue is almost as quick.
Yeah, I mean, that's the whole point of what you're saying.
Right.
Instead of going down your throat into your intestine, it takes 4, 5, 10 minutes, whatever. This is
It takes an hour when it goes down your throat.
And what about the oil under your tongue?
Now, the oil under your tongue, it takes maybe twice as long, so 3-4 minutes later, and sometimes it begins to be quicker, because our grandparents who had heart disease, there were very, very few medications, and people would be putting the nitros under their tongue. Our grandparents would open up this darkened colored bottle, put a nitro in, and within a couple of minutes their chest pain. So you're exactly right, that's how it works, and it actually stays in your system a little bit longer. When you ingest it, now there are no edibles in this state, but there are pills and tinctures and solutions you could put in your Coca-Cola. What happens is that they have to go through the intestine, which takes some time, and then every nutrient that goes through the intestine before going to the rest of the body goes through the liver. And in the liver, it actually converts it to a substance that's 11 times more potent than THC, but it's a gradual release kind of thing. So you might not feel the effect for a whole hour, sometimes even longer. Now, it will be in your system for a lot longer, perhaps as long as 8 to 10 hours, having a therapeutic effect. That's good for certain people, it's not good for certain people, because that means that during that period, you're considered impaired. So you shouldn't try and make important decisions. Whereas when you become a seasoned user of medicinal marijuana, you can more or less regulate it.
So no matter how you take it, I mean, is it once a day type thing? You do it 3 times a day, once a day, how many times do you have
As
to
many
do it?
times as you need it. Now, I primarily only use it in the evening, because I do driving and I do a lot of talking, and I have to be on my game all the time. So when I use it, most of the time it's when I'm done with work, after dinner, and I use a little bit, and then I relax, watch TV. Sometimes I go out with my wife, and then I sometimes might use a little, another little right before I go to sleep, because that
So you sleep better.
that helps me with sleep. And well, the thing that's keeping me up with sleep is the pain.
Yeah.
So, but everybody is their own guinea pig. There's no way of knowing what's best for you. That's why as part of our practice, we want you to come back. We want you to call us up. Somebody will always answer your questions. If you say you want to talk to the doctor, it might not be instantaneous, but in a short period of time, I'll get back to you. Because there are no rules with this. There aren't. And it's really, truly personalized medicine. And you're going to know what's best for you or what's worse for you. You're going to know what you need and what you don't need. There's no mystery to it. There's no magical power behind administering it. In fact, when you think about it, you have to be. I mean, I have a lot of experience. I've treated thousands of people. I read all the time. I write blogs. I go to meetings. Most of the other certifiers in Florida, anyway, you know what it's required to do? You have to take an online course that takes about a half an hour, and then you have to pass a quiz. You have to get 8 out of 10 correct, but you get 6 times to take it. How would you like to have a stroke and go into the emergency room and the doctor says, that's great, I just took the course and I passed it on the second time, yeah.
And you stayed at the Holiday Inn.
Right. So I take chronic suffering as serious as anything else. It ruins people's lives, and I've had people come in who were addicted to narcotics, not because they're bad, because they had to be, that hadn't worked, and that have, as a result of some of these symptoms, if you don't have depression and anxiety, you're going to get it. They couldn't sleep. They come in, they're new people. And these two ladies, Letitia and Lynette, who run the office here in the Orlando office, will tell you how thrilled the patients are. They love working with it because they get to help people. They get to experience the same thing that I do. We take frightened, hurting people and turn them around. In terms of disease, there are a whole bunch of conditions that are listed. If you want to ask me about your particular disease, you're welcome to. You're welcome to make an appointment to talk with me more. If you decide not to go with certification, I don't charge you.
So where's your office here?
It's